and welcome to Healthtech Pigeon, brought to you by the team at Somex, where we take a look under the hood of the best health tech stories of the week every single week. I'm Huw and I'm joined by Aaahuti from the Somex team, as well as some very special guests. Karina Vazirova, co-founder of Femtech Lab, and Kate Nikityuk, who is program coordinator at Femtech Lab as well. Karina, Kate, Aaahuti, welcome. How have your weeks been?
Thank you, Huw. Yes, never a dull moment in the world of digital health. But yeah, glad to be back onto Pigeon.
Hi, pleasure to be here.
Yeah, pleasure to be here. Big fan of the newsletter, actually. So it's nice to be on the audio version.
It's always good to meet a fan.
Yeah.
We're going to obviously talk about some great stories this week and have a bit of a wider discussion. But your flagship Women's Health Tech Conference returns for its second annual 2-day stretch next month. So just before we get started, I'd love to know how preparations are going, what attendees can expect, what have you got on the agenda, and anything special we should be looking forward to?
Yeah, absolutely. So Decoding the Future of Women is, as you mentioned, it's a 2-day event. It's a 2-day conference taking place during London Tech Week. It's our most exciting event of the year at Femtech Lab, really. And the mission of the conference is ultimately to change the narrative around women's health and to create this inspiration, buzz, and vision about what women's health could be in the future. So every panel, every talk, every exhibitor, everything at the event is following this ethos of looking into the future and creating this energy of inspiration so that everybody who attends just feels energized and charged to collaborate, to start a company, to invest, and to really think big in women's health. And the reason we launched the conference was ultimately because as founders in women's health, we, for the last 4 years, kept hearing how there's lack of funding, there's lack of data, there's lack of research, and this kind of words lack kept coming up again. And it was just frustrating because we saw how much potential and how many opportunities and just how fascinating female biology is. And we thought, you know what, why don't we create an event, a conference that makes everybody see that and makes everybody get really excited. So what people can expect from the event, it is 2 days of keynotes, panels, pitches, exhibitors, and all on futuristic topics. So things like ovarian longevity, space travel and human reproduction in space, psychedelic medicine, the future generations of women, how are they perceiving healthcare and how are they thinking about women's health and femtech? So every single talk actually looks into the future. And aside from sort of content and talks and conversations, the actual sort of experience at the event will also be kind of spiked with this futuristic element. So there's a dress code and everybody that shows up is encouraged to really express themselves in a way that's, again, sort of mirrors this futuristic version of women's health. So you can dress up in like a metallic space outfit, or you can dress up in really anything that's like signals and helps you to express your excitement about the future of women's health. So there's that fashion element to it as well. There will also be art throughout the venue to, again, get people really excited and inspired about all the different topics that are going to be covered.
As a producer of this conference, I want to add that everyone building this conference is very mission driven, starting from Biohacking Lounge and all the exhibitors that we were going to have there, Startup Innovation Room and all the startups who are going to expo their new things coming on the market. But also we will have a fantastic experience during lunch where the menus would be catered according to your hormonal cycle phase. And I think we've never seen this before in any health tech events, and we are very excited about. So it's very much about dedicating what women need at the phases and the time that women needs, and also thinking of what she might need in the future in 10 or 20 years' time.
I think it goes without saying. I don't think I've ever heard of anything like this at an event before. So it sounds like it's going to be a fantastic experience for attendees. I'd love to get a sense of. Obviously, the media is filled with lots of discussions about women's health now and the kind of technologies and the conversations that are being had now. Why is it that you've looked, say, 20, 30 years in the future for this conference in particular?
I think that at the moment we're experiencing this unprecedented momentum in women's health. I noticed in the Pigeon newsletter, women's health comes up more and more. We noticed that on TV, women's health comes up more and more. It's part of the government policy. It's part of a bigger conversation. Also from venture capital and startups perspective, there's more and more companies being founded and more investment that is being put into the space. However, I think that everybody's sort of wondering, what are those moonshot opportunities in women's health, and what, both from investor perspective, but also from larger corporate brands perspective, they're building products and doing R&D in women's health. What are those technologies and research opportunities that if we invest in them today, could make a huge difference in women's lives in the future. And I think that's why for us, it was important to look not just at what's happening in, consumer wellness right now, or health tech or digital health today, and even in the next 5 years, but actually what are the bigger opportunities that might have a longer R&D cycle, and would actually make a massive difference in women's lives over the next 20 years, because ultimately those are the opportunities and topics that are being invested in by the larger players right now. So I'll just give an example. For example, one of the, when we talk about menopause, the conversation about menopause today is very much around, what are the symptoms that women experience as they go through menopause, and what solutions can we offer for them to have a more comfortable experience and a better experience during menopause, like cooling bracelets or digital health solutions that help them manage perimenopause symptoms and the transition into menopause. But there's a parallel conversation around a topic called ovarian longevity, which involves understanding fundamentally why we go through menopause, what are the biological mechanisms and processes that happen in our body when we go through menopause, which relates to our egg reserve and how that gets depleted throughout our lifetime, and how genetic factors and lifestyle factors influence that. And after understanding that, how we could diagnose or predict an age for a woman to go through menopause, and potentially, if that is healthy, safe, and makes sense, to delay that age. And that conversation and that research and that technology and that science is not in the next 1, 2, or even 5 years. That is a 10-year life cycle for R&D development and diagnostics and therapeutics. So I think that's why it's so important to actually bring up those bigger, more futuristic topics, because they take that longer lifespan.
I mean, it sounds absolutely fascinating. In terms of, who's going to get the most out of the event?
Yeah, well, obviously, I think everyone would get the most out of the event. It could be a startup founder, it could be an investor, it could be a corporate innovating in women's health. We have a lot of women's health departments participating from big companies at the event. It could be academia, doctors, and everyone actually who is willing, all the early adopters of the new technologies who want to look at what's coming in the next 10, 20 years time, and what would be the topics to work on in the next years.
Fantastic. Well, it sounds like you're talking about it on the right podcast. Hopefully we can bring some new audiences to the event through here.
Yeah, no, I just wanted to jump in on a few things there, actually, because I think the features of this event, just sound incredibly exciting. Just even if we, at a basic level, like I want to go back to the point around, the menu and how the menu is being designed. And food is like such an emotive thing, right? And it brings people together. So one, that's great that you're also using lunch as an opportunity to still keep women's health at the forefront of the discussion so that people don't get distracted by yummy food. But, it's also a topic of conversation. But to that point, I actually love the fact that you're putting into practice what you preach, like there's clearly, I hear what you say about this being very mission led. And when something is truly mission led, you see how that mission manifests in everything that happens. And how you've described some of the features of the event, it's actually quite impressive. Even the dress code being an expression of a person's individuality is also sending a message about how we need to consider women's health. I mean, at health conferences, we can't even serve up healthy food often. So the fact that you've actually taken the approach to not just serve up nutritious, healthy food, it's a health conference, but you've then taken that a step further to actually bring into it the aspects about nutrition that are somewhat unique to women's health, and how that kind of ties into hormonal health. So, absolutely applaud, I guess, that kind of manifestation of mission into even some of those kind of detailed aspects of it. And I do love the fact that we've got a conference on the event scene here, which is looking slightly further ahead in terms of time horizons, because let's face it, the government's not going to do that. Investors are going to invest in futuristic stuff, but they still have a model, right? They still have a model about their returns and the payback and the liquidity events and the timing of those. And therefore, we do need to keep at the forefront of people's minds the art of what's possible, because then we don't go through such a steep education curve when it comes to some of these futuristic things that start becoming not so futuristic because they're within reach. And then we don't find ourselves in this situation where, but we now have to educate people on this because there isn't enough awareness. And we've seen that, haven't we? We've seen that with women's health and the journey of increasing awareness and education, which is why we're now starting to see a bit of a shift. And as we advance more and more, and I think this applies just to health more generally as well, but I'm not going to take away from the need to specifically do that for women's health because there's such a big gap to plug there. But the more we can actually invest some effort, energy, time, money on projecting out to a longer time horizon, the more we're going to kind of help people get more educated, aware and comfortable with what's coming down the line. And then we're more ready. There's a readiness to kind of jump on that, invest in it. It doesn't feel so scary. It doesn't feel such an unknown. So, I do applaud you for doing what you're doing because we need that. We need the other conferences that also address the more pressing issues of here and now, because we're not going to get to some of the futuristic stuff if we can't kind of cross that chasm. But really do like the fact that you're occupying that space about let's think further ahead.
And what's more important as well is that when we talk about the future, we think of positive ways of applying AI, applying the technologies, because there is so much going on now with ethics, with what problems we see in the industries, with the new technologies coming in. But we believe that women, when they are all together in one room thinking about how can we make the technology the best and the most earth-friendly, environmentally friendly, women's health friendly, I think that makes a big difference.
I love that actually. And another thing to note about the event is that it's 85. We just looked at the tickets and attendee statistics, and 85% of the attendees are women. I know that probably is obvious because it's a women's health event, but it still creates a certain energy, right? And what you said about the dress code and the food and those details, those like fun details, aesthetic details, it's also very feminine in a way. And we just love that. It just makes it fun. It makes it interesting. It makes it different. It makes it less corporate. And it felt for us more like us. It felt authentic to do it that way. And I loved also the second point that you mentioned around the importance of looking at some of these futuristic technologies now. I think great example for that, even though it's going to sound ridiculous, but space travel. When we first thought about that topic for the event almost a year ago, and we're like, let's make the theme like a spaceship and get a venue that looks like an actual space station, and let's have a few talks about how human species are going to reproduce in space. And we thought that's going to be just a wild part of the conference, and it's going to sort of be there really to stretch everyone's imagination. And then, we started looking into the sector. We started looking into space tech and space travel and talking to people and realizing that actually there's been all these advancements in the field, and that humans are planning to have a commercial space station by the end of this decade, that there's all these advancements and investments, and yet female space travelers, female astronauts that go into space have massive disruptions in their cycle, have disruptions in their reproductive health, and we have very little understanding of how actually going into space affects the female body. And when we spoke to some of the people in the industry, they said that there's a whole field of space medicine that actually is championing and advocating for tracking women's cycles in space, for trying to understand, can we even have sex in space? Can we reproduce in space? And getting women into that conversation. And they're saying, look, by the time that we actually are advanced enough in this field, we're going to have the same problem in space around women's health that we've created on planet Earth. And that's such a funny, it seems like a crazy futuristic topic. And maybe, now is a good time to talk about it, so that by the time that we get there, we are prepared and women are part of the conversation and leading it. So we don't have the same problems that we had in health on Earth.
This is a really disappointing time for everyone then, for me to bring us right back to Earth with our first story. I would honestly like to keep talking about space and women's health there for the rest of this podcast. But let's get on to the first story. So our first story comes to us from Femtech Insider. Seek launches first at-home test for alcohol's effects on women's health. So, recognising the lack of resources for women who want to continue drinking while taking care of their health, Seek is aiming to fill this void by offering a test that measures biomarkers across several health categories affected by alcohol, including heart, brain, gut microbiome, fertility, skin and breast cancer risk. Seek's founder Katie Gary has cited the prevalence of fitness and health trackers for other consumables, like sugar and processed food, but pointed out there is no singular resource for understanding how alcohol impacts women's health. The need, she says, stems from differences in how women metabolize alcohol differently to men due to physiological differences, which makes them more susceptible to various health issues such as heart disease, liver disease, breast cancer, and mental health problems. The panel of biomarkers that they rely on, they say, are the most sensitive to alcohol consumption based on the most comprehensive data set of alcohol on women's health. This allows women to see measurable improvements in their health, reinforcing the benefits of making even small adjustments to their drinking habits. So this can only be a good thing, right? This is something that taps into differences between men and women and helps empower women to actually make decisions that affect their own health. So I'd love to get Kate, Karina, from your view, any thoughts on the value of this technology? What's your initial reaction, I guess?
Yeah, I guess multiple reactions. I think it's an interesting symptom, or like an indication of where women are, and maybe also where future generations of women, like Gen Z, are on alcohol in general. And this like maybe bigger trend around people not just thinking about their health, but also thinking about their alcohol consumption, right? Like there's been more and more conversation recently around how much alcohol really impacts our health long term, the benefits of stopping drinking completely. A lot of people are actually quitting drinking completely. And I think it's quite interesting that trend and that behavior also manifests in products like this coming to the market. And for women in particular, and hormone health and long-term hormone health, we also obviously in our sector hear again and again how much alcohol can be a significant disruptor. So that is super relevant. I don't know in terms of problem and solution match, as in whether something like this is the most effective way to help kind of manage your alcohol consumption and to manage how alcohol influences your health. But I think it's as a research opportunity and as an opportunity to actually understand what happens in our body. And then as a result of understanding it, maybe come up with changes in how we consume alcohol, or maybe have different variations of alcohol, or dietary recommendations around what to consume with alcohol. That would be super cool to see come out of that. But yeah, that's my take.
I think it's a really interesting point, and you mentioned the sort of the move towards, particularly on Gen Z, of sort of giving up alcohol, and some of the warnings we've seen lately from organisations like the World Health Organization that of any alcohol being being potentially damaging, being potentially harmful. And I think if I take it, possibly the wrong move, but if I take it away from the sort of women's health angle, I think there's an interesting piece here, which is ultimately sort of those big warnings for, there will be people who will give up alcohol completely and go sober. And I think that's a, commendable lifestyle choice. I think if it works for you, that is, a valuable way of doing it. And then there will be people who, do continue to drink. And I wonder, whether this, if you sort of separate the women's health angle from it, it's the angle of the nuance piece, isn't it? So helping people to understand, okay, I understand that alcohol is harmful, but how much is harmful? How is it affecting me in particular? Can I make decisions? How should I adjust my own drinking in a way that, could help help improve my health outcomes to a certain point? What is too much for me? What is an acceptable level? What is within my own, I guess, personal risk assessment of my own drinking? So I think there's a kind of interesting point there in terms of the nuance that tests like this brings. Aaahuti, I'd love to get your reaction on this one.
So I think it adds another dimension to responsible drinking, and that can only be a good thing, right? So anything that's helping to raise the awareness of the impact of alcohol has to be a good thing. I find it interesting that the angle that seems to have been the starting point for this innovation, for this company to even set up, is alcohol is the issue behind your skin problems, or, whatever. It's almost like there's this hypothesis that alcohol is the problem. I think in a way that's probably a safe hypothesis and assumption, because we know actually that no amount of alcohol is good. I mean, the things that we read about, red wine is good for you if you have a glass a day or whatever. Well, we can get those benefits from drinking other things or consuming other foods. It doesn't actually have to be red wine, that we consume in order to kind of get the benefit of the properties in red wine. We can find those properties in other foods without the alcohol. So we know, really, we can't argue that apart from maybe some sort of social benefit, that from a nutritional perspective, from a health perspective, if all of us cut out alcohol, we wouldn't be losing anything necessarily from a health perspective. We would be gaining a lot. So I find it interesting that the starting point is more about sort of the fact that, alcohol is going to be the reason why you're suffering from all these different health conditions. And then it's almost providing the objectivity and the data to show how alcohol is contributing to these health issues. What I'm a little bit cynical about, however, is how they can isolate the effects only to alcohol. Because we know if we take inflammation, if we take the effect on skin, and there's a lot of research around the, correlation, the causation of alcohol on these health conditions, on these health concerns, right? But alcohol, essentially, there's a huge amount of sugar in alcohol. So, if what this test shows is the skin issues are because you're drinking a lot of cider and you're drinking a lot of wine, and that's the equivalent of X amount of cans of Coke, which is this amount of sugar, what we're then not seeing is a fuller picture around what else is happening in that person's life, because stress will also be causing skin issues, inflammation issues. Other dietary changes may also be required, partly, I think, a little bit to what Karina was saying earlier. So I'm a little bit concerned that it's taking a slice of the picture, and really impressed that there's going to be some objectivity around this, because what do we have at the moment apart from the government guidelines on how much to drink, and what's constituted as safe amounts of alcohol? So I do welcome it. I really do welcome it. I'm just really curious and a little bit cynical about how are we going to kind of keep this isolated only to the effects of alcohol on these conditions? And, if the health concern doesn't go away, so let's say that an individual's skin doesn't improve despite taking this test, despite reducing, let's just say, their wine, their cider, is that person then going to think, oh, that didn't work, I'm just going to go back and drink this? Or another scenario is if a particular alcohol is not seen to have a negative effect on some of these biomarkers, then is that effectively giving permission for someone that wants to drink that, oh, well, this doesn't really seem to have any effect, so I'm going to carry on drinking this? So obviously I haven't had the first-hand experience of taking this test. Haven't seen how the results get reported back. It does sound like they're taking an incredibly responsible approach, because it feels like it's a big education piece as part of the proposition, and some guidance as well about what to do and how to make the changes. So I do hope that kind of follows through. Definitely one to watch. It could be a new take on, a spin of a lot of other innovations and solutions out there that are helping more broadly with nutrition and fitness and effect on conditions. And this is a slice of that pie. So it'll be interesting to see how it lands.
I wonder as well whether with things like that, what is ultimately the target customer for this? Because if you look at somebody who
That was exactly my point. That was exactly what I wanted to comment.
Yeah, if you're looking at people that are already conscious about their drinking and they're very aware of their drinking and conscious about their health, whether it's all the way to biohacking end of the spectrum, or in general just being very conscious, if that's the demographic that is getting that test, I mean, it's a little bit of a self-selecting audience versus people that maybe consume much more alcohol and would really benefit from a test like this. But are they ultimately going to be the target buyer for this? Is it people that actually struggle with alcoholism and maybe are seeing somebody for that purpose and they're getting recommended this sort of test? That could be actually interesting. So to Aahuti's point, whether this could actually be more so a solution for people that are struggling and are trying to cut back, and maybe for them taking a test could facilitate that or help with that because they're more in tune with what's happening in their body. Sometimes that could be a huge motivator to get better and to stop drinking or to massively reduce it. That could be interesting positioning, and specifically for women if this is their angle.
And for me, this product is the product that indicates that there are so many unknown things in women that exist at the moment. If you're perimenopausal, if you have anxiety or mental health problem, or if you have any alcohol consumption, and start drinking more to cure those symptoms, actually, women just want some answers. And that's why probably they would buy that, not even Gen Z, but millennials, that are in their 30s and 40s at the moment. They could be the target customer, I believe.
Yeah, the article talks a little bit about this, but doesn't go as far as to say who the target audience is. And they explain it in the context of current healthcare practices, which typically involve a brief questionnaire at a doctor's visit. And only if the patient kind of self-reports to that doctor that they have excessive drinking or other related issues, does that kind of investigation go further? So it kind of implies, it doesn't say this, but it implies that this is really focused on those individuals that are light to moderate drinkers, however we would define that. by the way. But, that it's actually targeting, well, it seems to imply that it's targeting light to moderate drinkers. I totally agree, Karina, though. It is this kind of self-selected audience, and, therefore, is it really going to end up being about the wealthy that gravitate to this as well? And also the approach, I guess, in the way that it's being positioned. And of course, we've got to consider here that it could be the way the article is written, of course, and the product and the proposition might actually be very different. But the way that this is described is that it's not actually positioned to tackle addiction. It's to help women understand how alcohol is contributing to an already existing health concern that they have. So not necessarily that they're going into this thinking, I'm drinking too much, what can I do about this? So it's not actually about too much alcohol and the addiction issue or concern about alcohol, or too much, even if it hasn't quite got to addiction. It's more about, my skin's bothering me, this is bothering me, I wonder how alcohol might be contributing, because I want to ensure that that's part of my holistic approach to improving my health. So that's how it feels like it's positioned. And, if we've done a disjustice to this company just because of the way the article is written, then I'm very sorry. But that's definitely how it comes across.
Final comment on this, and on this piece of news, probably. What we see now accelerate in Femtech Lab, that there is a definitely growing trend for all those at-home testing. People want answers. They don't want wait lists. They don't want to wait in rooms. They don't want awkwardness. They just want to find out bits and pieces from the comfort of their home. And we see that not only with alcohol, we see that with cervical cancer screening at home tests. We see that with sperm screening, with check fertility being in our portfolio, doing that for men. So it's definitely the trend to ride on.
And something presumably that investors are very interested in generally. I think, perhaps taps into that kind of wider biomarker monitoring piece with all its positive and negative traits in the trend. But I think that takes us quite neatly onto our next story. So our next story comes to us from MedCity News: how women's health conversations with investors have evolved. During a panel session at the MedCity Invest Conference in Chicago, a number of founders of startups focusing on women's health issues shared their perspectives on the changing investor attitudes towards their companies and their wider sector. Particularly Joe Connolly, co-founder and CEO of Vazirova Health, which treats women for a range of conditions, including endometriosis, fibroids, menopause, and polycystic ovary syndrome, said that when Vazirova first started out, conversations with investors would shut down when he mentioned these conditions. This is a sentiment that was echoed by others, including Melissa Dennis, CMO at Partum Health. Both believe that things have begun to change. The reasons that they're pointing to: more women in larger VC firms, greater attention to the sector brought through social media, as well as the success of quite popular organisations such as Maven Clinic in bringing women's health into the open and to the forefront of investor conversations. So, Karina, Kate, I imagine this is one that you will have some very strong views on and some be able to cover in quite detail. So I'll hand over to you for your thoughts.
Yeah, thank you. Very relevant topic to what we do at Femtech Lab every day. Just for context, where our opinions come from is ultimately from the fact that our core operation for the last 4 years has been supporting startups in women's health. And a big part of that is making investor introductions. And so we have spent a lot of time having conversations with investors and curating a black book of angels, funds, family offices, whatever it may be, corporate venture arms that are interested in women's health. That list is now, I looked before this podcast, that list is around 490 investors. And again, it's a big part of what we do is curating those relationships and trying to understand what is everybody looking for and how that list of investors responds to every batch of companies that come through the accelerator when we present them to the investors. And also as a business ourselves, Femtech Lab, we raised capital 4 years ago and we have angels and VCs on our cap table. So we also have firsthand experience, not just pitching a particular women's health problem, issue, or opportunity, but pitching the sector as a whole and getting a lot of no's and getting enough yeses to be alive today. So I think we've definitely seen some evolution or multiple cycles of evolution in the last 4 years alone in how investors are looking at women's health. And I think there's a lot of trends here that sort of combine in influencing what investors are thinking about. So when we started 4 years ago, there was definitely an awareness or a starting awareness that this women's health, Femtech, whatever you call it, sector, industry, trend, opportunity is there. There was a big part of the investor pool that we would reach out to, and they would say, what is Femtech? Is that female founders? Is that what you guys are building? Accelerator for female founders? So we had to explain what Femtech was or what women's health was. Already was like a subgroup of investors that got it, that were interested. And when we pitched to our kind of current cap table, there was definitely an understanding, and it wasn't difficult to explain that this sector has huge potential, that it could be the next fintech type space, just because of the size and the ultimate and customer size and the virality of the space. Meaning, if you build a product that works for a woman, she's going to tell her friends. Like, women as a segment was one of our investors actually pointed this out. It's a viral segment. So those ideas 4 years ago, that understanding already existed. And then right now, especially with more and more public policy and public conversation spotlighting women's health. So in the US, the fact that the first lady is investing in this and talking about this brings the issue on the news, and investors read the news and they connect the dots that this is a trend, just like climate policy has been a very big issue, and climate tech is a growing and very invested in sector. I think the same thing is happening right now with women's health, where it's rising in importance in public policy there, which means there's going to be more grants, more investments, more support in that space. And just like with climate tech, I think with women's health tech, investors are expecting and will see more and more, and we will see more and more support of that and sort of spotlight of that in the public eye, which I think is making an amazing contribution to changing the investor narrative and having them see that this is becoming a bigger opportunity. But I think another sort of trend or wave or cycle that influences perception of women's health is what's happening in health tech in general, which you can also comment on. Maybe even more so than us is what's been happening, during COVID and the excitement during COVID that we had around digital healthcare, and then some disappointments around that. That also the narrative around health tech and investments in health tech and how companies in health tech have evolved. That also influences the perception of women's health tech, I think, and so that has had some influence of its own as well. And finally, I think that investors today, the kind of feedback that we keep getting today from investors is around how important it is to have more there are stricter expectations around evidence and clinical evidence that investors want to see from companies that are coming on the market, and more stricter expectations around seeing real outcomes and proof that whatever the product is going to make a significant difference in women's life, so that it will be either reimbursed through the healthcare system or the customer will want to pay for it out of pocket. So that has gotten actually stricter, which I think is a trend that isn't a women's health trend, but a trend that we sort of adopted and came to us from a broader healthcare and health tech industry.
I think Karina's captured so many important points there. We are more vocal now, as in society, and as it's like half the population have woken up and found their voice and are not shy of using it now when it comes to our health. And as a result, we understand more as well. And then I think helped by, and Karina mentioned this already, but, helped by massive funding announcements, like the Biden administration as well, and the First Lady in the US, and then UK's got their own women's health strategy. So I think these kind of things help. And, success breeds confidence. So we had this early wave of women's health companies like Maven and Clue and Day and, Bear Fertility. So these are examples of companies that were probably sort of considered the trailblazers, the risky investments, because there wasn't a playbook, there wasn't anything pre-existing in terms of a blueprint, something that a reference point that stakeholders could look at and say, oh, well, let's have a look at this company and what's been their journey. And therefore we can or can't invest in this company because they've got nothing kind of giving them that reference data and benchmark. And I think we're now starting to overcome that because some of these first wave companies are now starting to demonstrate results and traction and are actually sort of quite attractive as well. What I got a little bit stuck on with this article was the first statement around the funding landscape is getting better, partially due to more women getting promoted at VC firms. And to an extent, that's true. But I just kind of think we always have to be cautious whenever there's announcements about increase for female founders, increase of funding in women's health, increase of females at VCs, because when you actually look at the figures, the increases are minuscule, right? So any increase is progress, and I'm not going to take away from that. We have to, if we're going to inch forward, then, we're still moving forward. But, what would the big strides look like? And what's it going to take, for us not to have to inch forward, with these kind of minuscule percentage point increases. So I'm a little bit disturbed by any article that splashes out a headline about an increase. I think we have to do that. I appreciate it because it's also about creating a positive perception and, helping people kind of get that confidence, and headlines like that help. But I think there always has to be a sub headline to then talk about the fact that we've still got a way to go. If we look at the overall percentage of female partners in VCs, we've inched up from 15% to 16% over the past 5 years. 5 years for that, like 1 percentage point shift. So, women still represent this kind of minority when it comes to the VC world. And then when you actually look at how much of the investment capital they control, it's even smaller. I think, I can't remember the numbers off the top of my head, but I think it was like this 90%, 10% split. So the women in these VC positions are only controlling about 10% of the investment capital. So we have a heck of a way to go. And in fact, I think the number of angel investors across Europe actually dropped, and it was quite a significant drop last year, even though, 2021 saw this big surge that was maintained in 2022. And then in 2023 across Europe, I think it was about a 20% drop in angel investors. And that's actually really critical because we don't get to VCs at the first step. The first step are the angel investors. So if we're having a drop in female angel investors, then that's kind of almost like another barrier to overcome before we even get into the VC space. So I think we've got a long way to go when it comes to unblocking funding for women's health.
I agree with you, but women's health definitely has its momentum at the moment, because apart from the news from Biden, from UK policies, this week, Melinda Gates announced her contributions of 1 billion by 2026 for women's rights and women's health and well-being, which all gives us a sign that it will get better and the growth will continue to be for women's health inside the Healthtech.
Yeah, I agree. And I think actually it's very, like you say, what are the big strides? I loved that phrasing, actually. What are the big strides that will help us increase the amount of funding that goes into women's health? And I don't know, I don't think I agree that big stride or push for us or the solution is going to be waiting until we have enough women in VCs to write those checks and influence the decision making. I think it's going to have to be us pushing and continuing to articulate strongly the market opportunity here and the market sizes of various problem categories in women's health, like figuring out creative business models, figuring out how to get these products reimbursed for women, how to scale, how to get innovative. I think it's also pushing for more research in women's health so we can understand how some of our fundamental biological processes work so we can create diagnostics and therapeutics. I think it's going to have to be us maybe working extra hard, being extra to make it happen. But I think it's that what I'm betting on and what I'm hoping for is the energy of entrepreneurs, the audacity of entrepreneurs, the kind of the extra push that every single founder is making right now that is building in women's health. Every single time they're pitching to an investor, they're talking about the numbers of the markets, they're explaining the opportunity. That collectively, I think, is helping to change the narrative. And I would bet on that more, fortunately or unfortunately, than for us to wait until there's more women in VCs. And I totally agree with that part of the article. I don't know. Yeah, doesn't really, it's not accurately representing what's happening. And I don't think it's our best lever to push in order to get more funding in the space.
Totally agree. I think we definitely need more levers, definitely. And that exactly the reason to call that bit out, because that just gives a false impression that that's where our answer lies. In fact, earlier this week, there was an example of a company. I won't name the company because I think they're doing a fantastic job, but what I'm about to say demonstrates that they've got more work to do. But I asked the question, it's a company that's in the clinical research space, doing clinical research digitally, and they reported out their fantastic metrics around reduced cost of doing clinical research and trials and, the reduced time it takes to do the research now. And I asked what other metrics they report on, and there really wasn't much forthcoming in that answer. And I pushed again with a few other nudges and prompts, and still nothing was forthcoming. What I was actually looking for, what I was searching for and giving that company an opportunity to answer back with, is we also measure inclusivity in trials. We're also able to attract more women into trials. We're also able to now recruit, people with disabilities or from ethnic minorities or that are hard of hearing or can't see. That's what I wanted to hear as I prompted and nudged. And so that's just an example, Karina, where there's so much more that has to be done to bridge the gaps here. And even if we broaden out to just digital health more broadly and, expand out the Femtech view into just broader digital health, every company that's innovating in digital health has the opportunity to address the research gap, the data gap when it comes to women's health. How many of them actually are building that into their data strategies? I can't say, but it's a question that I ask every single digital health company that I work with, that how are you specifically designing for inclusivity and specifically for women's health? And mixed responses come back. So I think even now, as we're designing our future with all of these tools and technologies, and we're shaping the future of healthcare, I still think we're still adding to the problem of the research gap, the data gap for women's health, because not every company is still building that into the core of what they're doing.
100%. I agree. And actually, maybe another positive, not a spin, but like a positive thing to think about here is, I think that there's something happening in women's health because of the fact that it is, I think the article says 75%, or maybe I read that somewhere else, that a vast majority of founders in women's health are women, and they are building products for women, addressing women's health concerns. And ever since we started Femtech Lab, when we saw these founders come through the program, we saw ways in which they build business. We saw ways in which they think about the customer, the ways in which they pitch to investors. you can't help but see, especially personally coming from fintech, you can't help but see that also this sector is just different than any tech sector that I've worked with in the past, and I've worked in multiple. And I just wonder if, female founders in our space are going to redefine how you create, invest, and build a business in health tech within this sector that is women's health. The kind of business models you build, how do you leverage partnerships? I think there is a difference in how women's bodies operate from men, and there is a difference in how women invest versus men, and there's a difference in which women build companies to how men build companies. And in the last 4 years, we've definitely seen many examples of that. And I just wonder, maybe there will be something different about this space, something special, and something that will make it actually more sustainable and stronger than health tech in general, or fintech, or any other tech space that has operated on FOMO, aggressive cycles, and particular ways of doing venture capital investing. Maybe we can redefine some things, and I'm kind of hopeful about that, actually.
I think that's a hugely positive point to end on. So thank you so much for joining us, Kate and Karina. It's been really great to have you on the podcast, and we've really loved discussing these stories with you. Just to, with the last 30 seconds, is there anything else you want listeners to take away about the Decoding the Future of Women conference?
Well, we can't wait to see you all.
Fantastic. So a reminder that the conference is on 10th to 11th of June in London. We'll be there. We hope you will be too. There is a discount code for the Solmex community, which we'll include in the show notes for this episode, whether you're listening on Spotify or Apple Podcasts. Thank you for listening. You can find all of the stories in this week's newsletter, as well as some of the best events, jobs, and podcasts to listen to, all available at healthtechpigeon.com. Thanks so much. We'll see you next week.